Hello, everyone, and welcome back. It's been a crazy time. I hope you've enjoyed your extended spring break, and I hope this finds you all healthy and safe. We're going to try to move on here today with wellness, addiction, and destructive behavior. We're going to move into this subject and hopefully get you guys through the rest of the semester without little or no problem. So let's start. Wellness and addiction. Think about an experience that makes you feel good. You know, that might be completing a big project for class, eating a warm chocolate chip cookie, taking a swig of whiskey, maybe taking a puff from a cigarette. For some, it might be taking a shopping trip to their favorite outlet mall. But for some, it might be taking a hit of heroin or a dose of Vicodin. Now, these experiences don't necessarily lead to addiction, but what turns a habit into an addiction? What moves someone to seek out these feel-good experiences, even if they're costly or detrimental to their health and relationships? Addiction is engaging in any activity that appeals to personal pleasure and then becomes compulsive and interferes with ordinary responsibilities such as class, work, relationship, and your health. It's uncontrollable, physiological, psychological, and behavioral compulsion, a desire or dependence on an activity or substance. It's the behavior, something that you're doing casually turns into a habit, and then you become dependent upon that. It's an uncontrollable, physiological, psychological desire or dependence on something. Now, types of behavior addictions that are present in today's world: codependency, where you're dependent on another person. You can't do things for yourself. Food, gambling, sex, love, work, shopping. You're in debt because of what you do. Internet and games. All these are behaviors that can lead to addictions that become detrimental to your health and your psychological mindset. Okay. Classification of drugs. All right. Three primary types of drugs: over-the-counter, prescription, and illegal. Over-the-counter drugs are medications that are sold directly to a consumer without a prescription from a healthcare provider, from a doctor. Examples include, but not limited to, acetaminophen, Tylenol, ibuprofen or Advil, cough suppressants or Robitussin, or antihistamines such as Claritin. Prescription drugs. Prescription drugs are stronger medications prescribed by a doctor or dentist. Examples include opioids or pain relievers like Vicodin, OxyContin, depressants or meds that relieve anxiety, such as Valium or Xanax. They help you calm down, help you sleep, and stimulate and treat attention deficit disorder, such as Adderall or Ritalin. So prescription drugs are medications that are stronger and they're prescribed by a health care specialist, such as a doctor or dentist. Illegal drugs. Illegal drugs cannot be legally manufactured, bought, or sold in the United States. Examples: heroin, cocaine, amphetamines, and certain club drugs. Okay, so there are 5 main categories of drugs within those classifications. The first is a depressant. Depressants are drugs that inhibit the function of the central nervous system. The drugs lead to symptoms of drowsiness, decreased inhibitions, sleep, coma, and if taken incorrectly, even death. Examples of depressants are barbiturates, alcohol, opioids, and cannabis. Stimulants. Stimulants increase the levels of the nervous system. increase the activity in the nervous system, the central nervous system. Examples include caffeine, amphetamines, cocaine, Ritalin, Adderall, Vyvanse, and ecstasy. Opiates. Opiates are derived from the poppy plant. The drug works in the brain to produce a variety of effects with the main purpose of pain relief. Painkillers. Examples include heroin, OxyContin, Vicodin, morphine, fentanyl. Number 4, designer drugs. It refers to the drugs that are created in a lab, and they're typically illegal. A designer drug is created by altering the properties of a drug that comes from a plant like cocaine, morphine, or marijuana. Hallucinogens is a psychoactive agent which most causes hallucinations, perceptual anomalies, substantial subjective changes in thoughts and emotions. Hallucinogens alter normal brain function by disrupting communication between the brain and the spinal cord. They also hinder the release of serotonin, which is the chemical responsible for regulating your mood, your sleep, your sensory perception, body temperature, and muscle control. Examples of hallucinogens are LSD, ketamine, bath salts, and salvia. Okay, so many drug users or addicts, some of them or most of them begin with a gateway drug, which is alcohol, marijuana, something easily accessible that gets them hooked in, gets them reeled in to this behavior. Gateway drugs are substances that, when consumed, give way to harder, more dangerous drugs. These milder substances, such as nicotine or alcohol, are believed to open the doors to drugs such as meth, heroin, and cocaine, which can lead to an addiction. Okay, so drug abuse, also known as substance abuse, is a pattern used in the drug which the user consumes the substance in amounts or methods which are harmful to themselves or others and is a form of substance-related disorder. I'm going to say that again. Substance abuse, also known as drug abuse, is a patterned use of a drug in which the user consumes the substance in amounts or with methods which are harmful to themselves or others and is a form of substance-related disorder. Drug abuse is a pattern of related drug or alcohol use that often interferes with your health, work, your classes, your teams, and your social relationships. One of the greatest invitations for substance abuse and addiction in early life is for our youth to hang out with the wrong crowd, a wrong peer group, get hooked onto a bad group that dictates and makes poor choices. Peer pressure tempts our youth to make poor choices that lead to dire consequences. As you can see here in these photos that I'm going to be showing you, the use or abuse of any substance that puts you in an altered state of awareness or consciousness. Marijuana can do, drugs, alcohol can do great harm. As you can see, after 10 months, this young lady went from the left picture to the right, and because of marijuana, alcohol, and cocaine. And this one after 6 months, marijuana, alcohol, and heroin. 5 years, this gentleman started out marijuana, went to snorting heroin and meth, and is now strung out and in a bad place. This lady, after 1 year, these poor choices lead to bad things. Another one after 8 years, looks like something happened with a fire. Okay, 10 patterns of addictive behavior. Let me take a step back. So this is just like a regular class. I'm making changes as we go. All right, short-term and long-term impact of addiction. When taken, meth and crystal meth create a false sense of well-being and energy. A person will tend to push his body or her body faster and further than it is meant to go. They go and go, and they get a high. Leading to this, the drug users can experience a severe crash or physical and mental breakdown after the effects of the drugs wear off. And because continued use of the drug decreases natural feelings of hunger, users can experience extreme weight loss. Negative effects can also include disturbed sleep patterns, hyperactivity, nausea, delusions of power, increased aggressiveness, and irritability. Other serious effects can also include insomnia, confusion, hallucinations, anxiety, and paranoia. In some cases, addictive use can cause convulsions that will lead to death. So, some short-term effects of addiction include the following: loss of appetite, increased heart rate, high blood pressure, your body temperature is altered, dilation of pupils, your pupils, your eyes are affected. You have disturbed sleep patterns, nausea, bizarre, erratic, sometimes violent behavior, hallucinations, hyperexcitability, irritability, panic, anxiety, psychosis, convulsions, seizure, death, overdoses, long-term effects, permanent damage to blood vessels of heart and the brain, high blood pressure leading to heart attacks, strokes, and death, liver, kidney, and lung damage, destruction of tissues if sniffed through the nose, respiratory or breathing problems if smoked, infectious diseases and abscesses if injected, malnutrition due to weight loss or ending in weight loss, severe tooth decay, disorientation, apathy, confused, exhaustion, strong psychological dependence, psychosis, depression, body odor, damage to the brain, such as Alzheimer's, something like Alzheimer's disease. Stroke is possible, and epilepsy. Some bad things happen if you make the wrong choices and fall into this addictive behavior. So 10 patterns of an addictive behavior. Number 1, unsuccessful attempts to quit. Addicts often express a desire to quit completely, but are unable to follow through. Short-term abstention is common, but long-term relapse rates are high, meaning that they may be able to stop for a short period of time, but initially it's going to come back and there's going to be a relapse and it will become worse. As Mark Twain said about the pains of quitting smoking, it's easy. Done it 1,000 times. Cue-triggered relapse. Number 2, experience with an addictive substance sensitizes the user to environmental cues that subsequently trigger cravings. These cues, like clinking ice cubes, signal opportunities for consumption. For example, upon exiting rehab, addicts who return to their old environment are more likely to experience cravings and resume use. So if you enter rehab, you go through a process, but you go back to the same places where you had made poor choices in your old environment, you're more likely to fall back into those same patterns. A recovering addict is also significantly more likely to fall off the wagon if he receives a small taste of his or her drug of choice or experiences stress. This is a phenomenon that alcoholics can't resume occasional drinking without losing control. They're not able to go back and just have 1 or 2 drinks. They just fall back into that same pattern. Number 3, loss of control. Loss of control means that one is knowingly acting against their prior determination to abstain. For example, consuming a large portion of dessert after deciding to go on a diet. The typical reaction to this failure involves strong negative emotions, depression, and self-loathing. It is instructive that the 12-step program of Alcoholics Anonymous begins, we admit we are powerless over alcohol, that our lives have become unmanageable. Starts out again, we admit we are powerless over alcohol, over the substance, that our lives have become unmanageable. You become a victim to that heroin or the cocaine or the alcohol, whatever it may be. You become managed by that addiction. Number 4, desire without pleasure. Addicts commonly continue their behavior even while reporting that the substance, cigarette or drink, for example, is no longer pleasurable. Addicts often express that they continue to use drugs even when they are no longer done for pleasure. For example, some cigarette smokers express a deep hatred of smoking, but they still do it on a regular basis because they're addicted and need that fix. Number 5, staying vigilant. Despite the development of some effective treatments, there is no cure for addiction. Recovering addicts often manage their tendency to make mistakes by exercising cognitive control, such as voluntary reducing or eliminating future options. The main purpose is to reduce the probability of encountering cues that will trigger relapse. For example, even addicts who have stayed clean for years attend the meetings of support groups like AA, settings in which no individual therapies or drugs are provided. They take themselves out of that environment, take themselves away from that temptation, staying vigilant and working on your treatment. Cross addiction. Number 6, many addicts often substitute one compulsive problem for another. They become compulsive workers or gamblers, or use sex as they once used chemicals to combat the emptiness that they feel inside, the boredom, anxiety, depression that constantly threatens to overwhelm them. Number 7, self-medication. The self-medication theory of an addiction suggests that individuals with deficits in emotion regulation skills, the skills relevant for modifying emotional reactions and tolerating negative emotions, may use drugs to manage negative or distressing affective states. So they're using the drug to just make it through the day, to turn a negative situation or feeling into feeling of pleasure. For instance, individuals with histories of exposure to adverse childhood environments, such as physical or sexual abuse, tend to have a diminished capacity to regulate negative emotions and cope effectively with stress. Once again, the self-medication theory suggests that individuals with deficits in emotion regulation skills, the skills relevant for modifying emotional reactions and tolerating negative emotions, may use drugs to manage negative or distressing affective states. Number 8, genetic vulnerability. Most individuals who try drugs use them for only a few times. Some will never advance beyond experimentation. Others will quickly become deeply involved and stay that way for a long time. They'll become hooked. There is a substantial evidence of a genetic predisposition to develop an addiction. For example, due to genetic vulnerability, children of alcoholics are at a higher risk for future alcohol problems, and many show high levels of impulsivity. Thus, you may have 2 glasses of wine and desire no more, and yet a genetically vulnerable person struggles to stop with 6. Number 9, substance abuser versus addict. Is there a difference between a substance abuser and an addict or alcoholic? At some undefined point, substance abusers are no longer in control of their substance use. Just as a pickle can never become a cucumber again, once a person crosses over this undefined line, there is an alteration in brain circuitry that cannot be reversed. Every drug addict starts out as an occasional user and then shifts to a compulsive user or abuser. Number 10, Addiction is not limited to substance abuse. The psychological concept of operant conditioning suggests that if a behavior is followed by a rewarding experience, an animal or individual becomes more likely to repeat the rewarding behavior at a later time. For example, a dog performs a trick to get a dog treat. In human beings, operant conditioning allows them to learn behavior leading to certain rewards or consequences. For example, learning that playing video games or web surfing, shopping, is followed by a reduction in distress, an individual will be more likely to engage in that act in the future. So if they play video games or surf the web or go shopping, if this takes away their bad feeling, takes away their stress, makes them feel good, they're more apt to engage in that act in the future and become a pattern. Addictive behavior, psychosocial connection, people that have lack of self-esteem, lack of confidence, are in a group that puts pressure on you to try something, are more likely to become addictive. Stress, something to find to give you, to take off that edge, give you that fix. Biological connections, factors related to hormones, neurotransmitters, and biochemical changes in your body. Deficiencies in your brain and neurotransmitters make you, once you try something, make you want to keep going after it. Peer pressure is a big factor in both, especially the psychological or psychosocial connection, getting you to try it and then getting you hooked. So let me go back. Who's most likely to become addicted? Each person's body and brain are different. People also react differently to drugs. Some love the feeling for the first time they try it and want more of it. Others hate it and never try it again. Not everyone who uses drugs becomes addicted, but it can happen to anyone at any age. Some things may raise your chances of addiction, including family history, genetics. If your parents or siblings have problems with alcohol or drugs, you're more likely to have the same problem. Women and men are equally likely to become addicted. It's not either gender that has the more become addicted. Early drug use. Children, when they're young, their brains are still growing, and drug use, for some whatever reason, can affect them and make them more applicable to be an addict down the line, or once you crave that medication or that feeling. So taking drugs at an early age may make you more likely to get addicted when you get older. All right, mental disorders. If you're depressed, have trouble paying attention, or worry constantly, you have a higher chance of addiction. You may turn to drugs to try to feel better, try to take that edge off and give you some hope, but it doesn't. It makes things worse. If you have trouble with relationships, if you grew up in a family that has troubles, you aren't close to your siblings, you aren't close to your parents, this will raise your chances of an addiction to find something that fills the void of those relationships. Signs of addiction. You may have one or more of these warning signs. An urge to use the drug every day or many times a day. You take more drugs than you want and for longer than you thought you would. You always have that drug with you and you buy it even if you can't afford it. You keep using drugs even if it causes you trouble at work or makes you lash out at family and friends. You spend more time alone. You don't take care of yourself or care how you look. You steal, lie, do dangerous things like driving while high, having unsafe sex, unprotected sex. You spend most of your time getting, using, or recovering from the effects of the drug. You feel sick when you try to quit. That drug owns you and dictates what you do and what you think. Addictive effects on our workplace. Drinking and drugging among U.S. workers create costly medical, social, and other problems that affect both employees and employers. Alcohol and drug abuse by employees can cause many expensive problems for businesses and industries, ranging from lost productivity, injuries, and an increase in health insurance claims. The loss to companies in the United States due to alcohol and drug-related abuse by employees totals around $100 billion a year, according to the National Clearinghouse for Alcohol and Drug Information. These staggering numbers do not include the cost of diverting company resources that could be used for other purposes towards addressing substance abuse issues. They're spending money that they could be spending elsewhere that's productive. They're spending it on their employees who have made poor choices. It also does not include the pain and suffering aspects, which cannot be measured in economic terms. So the pain and suffering that the employers feel for the loss of productivity, and the employee whose life is turned upside down, there's pain and suffering that cannot be measured by any dollar figure. Another thing that with addictive effects on the workplace includes substance abuse among employees, which can threaten public safety, impair job performance, and threaten their own safety. Family issues with substance abuse. Rippling effect. Instability within the family system. People suffering from an addiction are often unreliable and cannot be counted on to do what they say. Other family members are left to pick up the slack when the addict does not attend to or his or her responsibilities. Finances suffer. Relationships suffer. Household chores suffer. This causes conflict and instability within the family, and other family members are continuously let down or can never predict that addict's behavior, what he's going to do or what she's going to come through. Is she going to do what she says? You cannot trust or count on them. There's mistrust, lying, and stealing. Once addiction has taken a hold of you, people can turn to lying and stealing to hide and support their drug abuse. They'll make excuses. They'll try to barter, try to get things by saying things that you want to hear, telling lies that gets them what they want. You can't trust them. This behavior creates resentment, mistrust, and turmoil within relationships of friends and family. Financial distress. Alcohol, drug abuse can lead to problems at work, like we just mentioned. Decreased productivity, missed work and job loss. If you're hourly, you miss hours that go on the paycheck. Loss in wages, loss in salary. Addiction creates a financial burden that may cause families to lose their home or have difficulty providing basic needs such as food and health care for their children and family. The addict may rely on financial support from other family members, which further strains relationships. That financial burden affects not only the addict, but it affects the person that is having to support them. Conflict amongst family members. Addiction can lead to negativism, where all the communication taking place amongst the addict and the family members is negative. The relationship is not good. Anger and resentment causes each person to lash out at each other. Complaints, criticism, and put downs may become the norm, which leaves everybody in the situation feeling bad. Shame and denial. When one member experiences addiction, often the whole family will suffer from shame and denial. Families may work hard to hide the consequences of addiction and develop elaborate systems of denial that there is any problem at all. They try to sweep it underneath the rug. Deep feelings of shame may lead other family members to also abuse substances to cope. Codependency. Codependency is a behavioral condition in a relationship where one person enables another person's addiction, poor mental health, immaturity, irresponsibility, or underachievement. Among the core characteristics of codependency is an excessive reliance on other people for approval and a sense of identity. Giving support to your friend at the cost of your own mental, emotional, and physical health, and valuing the approval of others more than yourself are signs of codependency. You're more worried about the other person than are you. You rely on them. Enabling. Enabling allows someone to persist in an abusive or addictive behavior. The term is often used in the context of a relationship with an addict. It is doing something for an individual, addict or not, whom could and should be doing things for themselves. Now, don't confuse this with helping. Helping is when you help somebody else that is not able to do it for themselves. Enabling is helping somebody and aiding somebody do something that they shouldn't, but they can take care of them by themselves. Such as examples of codependency: believing they're protecting their loved one. Behaviors are changed to aid the addict or abuser. Accepting additional responsibilities. Enabling, making excuses for behavior, hiding the behavior, loaning them money, enabling them to continue those poor choices and poor behaviors. Treatment. Can addiction be cured? No, but it can be managed successfully with proper treatment. But treatment is lifelong. It's not a death sentence, but it is chronic, it's progressive, and it can be characterized by relapses. And if untreated or mistreated, it can result in death. 70% of alcoholics who stay engaged in treatment for at least 1 year achieve lifelong sobriety. But with drugs, it's between 50 to 60%. Those numbers are much better than for similar diseases requiring constant lifelong treatment. Yet there's an expectation that 20 days or intermittent treatment works. It doesn't. You need to keep on it and be steady, and it's progressive. You need to stick with treatment and having people keep you accountable. Treatment for addiction works if the person stays engaged in that treatment. Okay, some of the things that you see from an addict when you're going to treatment. That person needs to recognize and accept that they've got a problem. Be informed, get information, avoid a short-term fix. It's not a short-term fix type of illness. Okay, you need to be self-motivated. You need to become aggressive in wanting to become better. Get counseling, therapy, and ask for medical assistance and someone to keep you honest with this treatment. Okay, so now we're going to go to the second part of this PowerPoint, destructive behaviors. Destructive behaviors, okay, bad things happen to people. Some seek help, others succumb to substance abuse or make poor choices. Some people deal with their problems in a different way through self-destructive behaviors. A self-destructive behavior is any behavior that is harmful or potentially harmful toward the person who engages in the behavior. Self-destructive behavior is any behavior that is harmful or potentially harmful toward the person who engages in the behavior. It's a continuum with the extreme end of the scale being suicide. Anywhere from picking, cutting, making poor choices with alcohol, making poor choices with cigarettes, vaping, whatever it may be. is the one end, and it goes down. It gets extremely worse. And when it comes to suicide, when you can't cope with what's going on in your head, you make rash decisions and make poor decisions. Self-destructive behavior is basically a coping mechanism caused by loss, pain, or trauma. Something that is bothering you that you cannot fix. So you try to take out your anger, your anxiety, not on somebody else, but you take it out on yourself. Self-injury or self-harm, self-mutilation is defined as an act wherein somebody deliberately hurts or injures themselves. Self-injury is most often used as a coping mechanism and is not an attempt to commit suicide. It is a way of dealing with very strong emotions. It's a loss of self-control. For some people, self-harm gives the relief that crying may provide for the rest of us. We're able to get that release by having a good cry, or these people need to do something destructive to themselves to make them feel better. Some people who engage in self-mutilation feel they can't control highly their anger or aggressive emotions. They become afraid that they might hurt somebody, so they turn their aggression inwards to get relief. They take it out on themselves. This practice is not related or limited to teens, but data suggests as many as 20% of American teens have engaged in self-harm behavior, with the rate higher in girls. So 20% of all American teens have done some kind of self-injury or some destructive behavior to vent, to cope with something that they're struggling with. People who self-harm may be defined as attention seekers. However, a person who engages in self-injury may believe this is the only way to communicate their distress. They're reaching out, they're crying out for help. This is what they think that they can do to ask for help. They can't just go to someone. They have to do something extreme to get the attention. Attention seeking may be the last motivation, as self-mutilation can be a hidden problem that goes on for years. Self-harming purely for attention is one of the big myths about self-injury. Self-injury may start as a spur-of-the-moment outlet for anger and frustration, such as punching a wall, and then develop into a major way of coping with stress that, because it remains hidden, generates more stress. Usually, as time passes, one of the effects of self-harm is that a person who is self-injuring becomes more accustomed to the pain they inflict on themselves, and so they harm themselves more severely to get that same level of relief. This spiral can lead to permanent injury, serious infections, and even lead to death. Smoking as a destructive behavior. Smoking can cause lung disease by damaging your airways and the small air sacs or alveoli found in your lungs. Lung diseases caused by smoking include COPD, which includes emphysema and chronic bronchitis. Cigarette smoking causes most of the cases of lung cancer. And not only smoking is hurting that smoker, but the environment tobacco smoked, or the secondhand smoke, the smoke exhaled by the smokers, is known to contribute to others around them to make them sick. So the secondhand smoke is just as dangerous as the person that is doing the smoking. Alcohol. Alcohol affects your appearance, bad breath, and body odor. It reduces your not only athletic performance, but your daily performance in your work ethic, your work, how you feel. It makes you, gives you a higher risk of injury because you're going to make mistakes, increased risk of illness, slower healing time. Excuse me. Although a person may not be abusing alcohol regularly, they can still experience its short-term effects on the mind and body. The liver. The liver takes the brunt of it. The liver can metabolize about 1 standard drink of alcohol per hour. However, this can vary depending on several factors, including the individual's age, weight, liver function, and gender. Typically, consuming more than 1 beverage per hour can lead to intoxication, raising an individual's blood alcohol content with each drink. The effects of alcohol can range from mild, such as skin flushing, to more severe symptoms such as passing out or vomiting. Other short-term effects can include lowered inhibitions, leading to poor social judgment. You're going to do things that you regularly wouldn't do if you weren't drunk. You'll have trouble concentrating, a loss of coordination, loss of critical judgment, a dulled perception, especially your vision. You're going to have mood swings. You're going to be anywhere from mellow to agitated. You're going to reduce your core body temperature. Your blood pressure will rise. You may pass out. And you're certainly going to vomit if you become too drunk, too intoxicated. Long-term effects of alcohol. Drinking too much over time can cause chronic physical and mental health issues. Heavy drinking can cause or contribute to liver damage, cardiovascular disease, and multiple types of cancer. Long-term effects of excessive drinking may include memory loss, loss of attention span, trouble learning, alcoholic hepatitis, liver fibrosis, throat, mouth, larynx, breast, liver, colorectal, and esophageal cancer. As we talked about before, alcohol is one of those gateway drugs that can lead to something more that is going to give you that feeling of euphoria that's going to take care of all your problems. High blood pressure and stroke, irregular heartbeat is also a long-term effect of drinking excessive alcohol on an addictive basis. When consuming alcohol, it affects virtually every system in the body. There's no part of your body that is not affected by drinking alcohol. Prescription drug abuse, another destructive behavior. Signs and symptoms of this abuse. Prescription drug abuse and addiction is one of the most poorly recognized types of chemical dependency, particularly in women. A prescription drug is any medicine regulated by law to require a doctor's prescription before it can be obtained, as we determined before, by a health provider, a doctor. Prescription drugs generally work by either suppressing or promoting chemical reactions in the brain. Drug-seeking behaviors are the primary warning signs of prescription drug abuse, regardless of the chemical makeup of the medication. This starts with opioids, the opioid crisis. A person has an accident, has an injury. They're started on painkillers. They get that. They take the painkiller for a short amount of time. Doesn't do the job. They want something stronger, and it just keeps building and spirals down a bad trail. Behaviors within prescription drug abuse, frequent requests for refills from physicians, losing prescriptions and requesting replacements regularly, going to other doctors for the same prescription, crushing or breaking the pills, stealing or borrowing prescription medications from family members, friends, coworkers, consuming prescriptions much faster than regulated or suggested, visiting multiple doctors for similar conditions, like I said before, asking for the same prescription or something stronger. Inconsistent answers to questions about prescription usage. They have lies. They tell lies and they can't keep them straight. Stealing prescriptions from pharmacy or from a doctor's office. Consumption of over-the-counter drugs for the same conditions that a doctor has prescribed other medication. So adding on to the Vicodin or OxyContin, you're adding on Advil, ibuprofen, just trying to give you that extra fix. ordering a prescription medications over the internet, trying to get a 90-day prescription and going through it faster than 90 days. An addiction to other drugs or alcohol can also coexist with this prescription drug abuse. They mix it. Many people have found to mix alcohol with prescription medications to accentuate that feeling of euphoria. This mixture is often referred to as a cocktail. The risk of overdose in this situation is severely high. Now, the effects of prescription drug abuse include the abuse of prescription drugs often result in negative effects on personal relationships, difficulties at the workplace, job loss, financial difficulties, legal issues, and mental problems. Prescription drug abuse and addiction are serious medical conditions that require treatment by chemical dependency specialists. Reducing one's use of certain prescriptions can involve serious medical complications, including death. Detoxification from prescription drugs should not be attempted at home or without direct supervision from a medical doctor. Another destructive behavior, excessive eating. Okay, gluttony. We learned that in the first few weeks with the deadly sins, 7 deadly sins. So what are the signs and symptoms of compulsive overeating? A person with symptoms of compulsive overeating has what can be characterized as an addiction to food. They use food and eating to hide from or manage their emotions, to sneak away from their troubles, to fill a void that they have inside, to cope with daily stresses and problems in their lives. Signs and symptoms of compulsive overeating include binge eating, eating uncontrollably even when they're not hungry, physically hungry, eating alone due to shame and embarrassment, feelings of guilt due to overeating, preoccupation with body weight, depression or mood swings, history of weight fluctuations, a withdrawal from activities because of embarrassment about their weight. They're embarrassed to be around others because they have gained so much weight. They have a history of many different unsuccessful diets. It's like a roller coaster. You know, they go up and down. They lose and then they gain more back. They don't eat in public because they're afraid. They're embarrassed. They hide food in strange places throughout the house, closets, cabinets, suitcases, under the bed, self-defeating statements after food consumption. They're down on themselves. They're mad at themselves, and they take their frustration out on themselves. Fatigue. Their makeup, their metabolism, they don't have energy to just go through their normal daily activities. Effects of compulsive overeating. Effects include compulsive overeating produces emotional, psychological, and physiological side effects that can compromise one's quality of life and hope for a long future. When a compulsive overeater consumes excessive amounts of food, it can produce a euphoric feeling like that experienced through a drug use. They feel a temporary release from psychological stress and a diversion from feelings of sadness, shame, loneliness, anger, or fear. But that changes. That changes quickly as they feel the guilt, the anger for what they had just done. Left untreated, compulsive overeating can lead to serious medical conditions, including high cholesterol, diabetes, heart disease, hypertension, high blood pressure, sleep apnea, which is a temporary suspension of breathing during sleep, major depression, kidney disease, arthritis, bone deterioration, stroke. It just is not healthy. It puts a lot of pressure on your internal organs to carry around excessive amounts of weight. One thing that this excessive eating does not do, they do not purge, as they do in bulimia. They just eat and they just gain on and pack on the pounds. which leads to embarrassment, to isolation, and more destructive behaviors can develop. Sexual behaviors, destructive behavior, can lead to unexpected pregnancy. All right, relationship problems. Compulsive sexual behavior can have many negative consequences that affect both you and others. You, your partners, your partner, and others, such as your friends and family. It can affect mentally and physically. You're going to struggle with feelings of guilt, shame, low self-esteem. Depression can set in. Severe distress and anxiety can push you to deep depths that may lead to even suicide. But some of the physical complications that can come from your sexual behavior, unprotected sex, chlamydia, okay, gonorrhea, herpes, syphilis, HPV, HIV. Okay, some really bad things can happen if you don't make the right report, or if you don't make good decisions. Excuse me. Helping others. It is possible to, excuse me, it is possible to overcome addiction and these destructive behaviors with consistent help and support. The first step in solving the problem of substance abuse is realizing and accepting that you have a problem. The goal of any intervention plan is to diminish and ultimately eliminate that abuser or addict's denial of a problem. They've got to admit that they have a problem, and then you can start working on it and building their confidence, building their trust back between you and the addict. Families need to be there supportive of the family member that's the abuser. Set realistic goals. Okay, set some smaller milestones that you can achieve and celebrate those milestones. Clean your mess up in your life, relationships, your health, your diet, your lifestyle. Make the change. The don'ts of intervention is to not nag, don't plead, don't beg, manipulate, or threaten. That's only going to push that person back into the corner, and they're going to not be open to that constructive help. The do's of helping others or intervention include showing concern, be encouraging and supportive, provide facts and data that are relevant to a person's addictive behavior. You know, be positive, show others that have had the same issue, the same problem, and have overcome it through therapy and treatment. Be supportive. Helping others, one way to help others is using the confront approach. You know, be concerned, be organized, know what you're going to do, how to do it, and when to do it. Do what you need to get assistance in helping others. Face the issue together. Be empathetic. Don't be, don't critique. Don't be a critic when it comes to that person. Respond. Not only give support verbally, but listen. Listen to what they're saying. Okay. Offer, provide help. Offer, provide help, suggestions and guidance, negotiate, plan additional conversations and times to keep working towards that goal. Like we said before, it's not something you're going to cure. It's a lifelong treatment that you need to keep continuously be working on. Like I said, be patient. Time is on your side if you make the effort. Okay, this has been an interesting first PowerPoint voiceover. I thank you for your patience, and I will get the other ones next to you out as soon as possible, load them up to Moodle. And like I said, I appreciate your patience. This is new and definitely out of my comfort zone. So thank you. And if you have any questions, please don't hesitate to send me an email. Thank you.